So I'm doing elbow flexion, hip flexion, knee flexion, and cervical extension. So for the first one, elbow flexion, I will instruct the patient to lie supine on this table and bring your forearm supinated. Perfect. And the axis goes along the lateral epicondyle of the humerus, and the stationary arm goes along the acromion process. And then the moving arm goes along the radius. And you can now flex your elbow. Awesome, just like a bicep curl. Perfect. Awesome, and the reading on the goniometer comes to 133. For the second one, for hip flexion, I will have the patient again supine, legs relaxed and straight, and the axis goes along the greater trochanter. Stationary arm is along the midline of the pelvis, and the moving arm is along the femur and the lateral epicondyle. And I will instruct the patient to flex the hip or bring the knee to the chest. Awesome. That's along the lateral epicondyle here. And the reading is exactly 120. Whoops, I moved it. 120. Perfect. For the third one, for knee flexion, again, the patient can be supine. And I'll have him flex his knee up to the hip. Perfect. And the axis is along the lateral epicondyle. Stationary arm is aligned with the greater trochanter. And the moving arm is aligned with the lateral malleolus. Right there. And go ahead and bring your knee as far as you can to your butt. Awesome. And the reading on the goniometer is 139. Right there. All right, last one is cervical extension. So this time the patient can be sitting with back support. Perfect. And the axis goes along the external auditory meatus. Stationary arm is vertical or perpendicular to the ground. And the moving arm goes to 90 and is aligned with the nostrils. All right, and you can go ahead and look up at the sky as far as you can. Perfect. Align with the nostrils. Awesome, so that's at 30, but we started at 90. So the reading is 60 degrees.